We're now turning to the fight against COVID-19. We're getting an update on the number of vaccines heading to Texas this week. The state health department says nearly 2 million doses will arrive tomorrow. More than 700,000 of those are set aside to be first doses. Nearly 690,000 are second doses, and about 500,000 shots will be sent to pharmacies across the state. Now that includes both first and second doses. By the way, a little more than 6 million Texans are now fully vaccinated. Texas will get more funding to fight variants of the coronavirus. White House officials say they're sending the state more than $15 million. Now we're told this money will be handed out in May, with more coming in future installments. The investment is aimed at helping the CDC, states, and other agencies really improve their ability to identify mutations and monitor the spread of those variants. And new details about the pause of the Johnson & Johnson vaccine. A CDC advisory panel has scheduled yet another emergency meeting. Now this will happen at the end of this week. On Friday, the group met last week and decided to extend the temporary pause of the vaccine to give themselves more time for additional evidence and to review what's really going on with the vaccine. Now, if you or someone you know needs help finding a vaccine, or you just want more information about the shots, please be sure to check out WFAA.com. That's where we're updating our list with all the latest information, and we can make it very easy to send that information to you as well. So please text the word vaccines to 214-977-6028. The number's on your screen here. Text vaccines to 214-977-6028, and we'll send you that link right to your phone so that you can get all the information that you need. And while we're on the topic of vaccines, there's a lot of discussion right now about the shots protection only lasting 6 months. But is that really the case? We asked our Verify team to check it out.
Verify is all about fact-checking the suspicious things you see online and answering your questions. Several viewers emailed the team about this one, including John Selhorn from Potomac Falls, Virginia. He wants us to verify, is it true that the COVID-19 vaccines are only effective for 6 months? We brought that question to our experts, our two favorite Williams, Dr. William Schaffner, an infectious diseases professor at Vanderbilt University Medical Center, and Dr. William Moss, the executive director of the International Vaccine Access Center at Johns Hopkins. So what's up with this 6-month stat? Well, it's actually pretty straightforward. Our experts explain that that's roughly how long it's been since those very first patients got a dose.
The clock is ticking. We're measuring it. We can't tell you any longer than that because we've only used the vaccines for 6 months. So hold on. We all think that these vaccines last, given their protection, last longer than 6 months. But we'll tell you that as we continue to measure the duration of protection.
The other William agrees.
And that's why it's important, for example, that the phase 3 trial actually be allowed to continue the initial phase 3 trial, the follow-up of those individuals out 2 or 3 years to look at the duration of protection. So I think whenever they say, like, the duration of protections, they'll say at least 3 months or at least 6 months, because basically that's just how much time we've had.
The CDC also says that at this point, they don't know how long protection lasts. So we could verify that no. Our experts say it's not that the COVID vaccines will only work for 6 months. What can be said is that they're effective for at least 6 months because that's the data we have. With your Verify, I'm Evan Kozloff.